go through case 3, which is a 40-year-old female who has a recent diagnosis of right traumatic above knee amputation, as well as her imaginary left leg that would be here if we were able to had the privilege of working with a real patient. This left leg here has some abrasions, but it didn't require any sort of amputation the way the right one did. So right now this leg isn't wrapped. I just have it wrapped so it keeps its form a little bit for the sensation testing we're going to do first. So in her case, it says that her sensory is fairly intact, but just with some, it says within normal limits, except with hypersensitivity at the end of her residual limb. So we're going to do a little bit of sensation testing just to be able to advise her on any sort of skin care that we would do. So I have a little tool from my old reflex hammer that I own. So there's a sharp end and kind of like a dull end here. So I would have her close her eyes, and then I would go through and try to mimic the dermatomal pattern and kind of check, and then of course check from this limb to her left limb and do, sharp or dull. I'm using the dull end right now. Sharp or dull. Do that same on the other side, and in a random order so they can't predict what you're doing. And then again, now I'm going to use the sharp end, sharp or dull, and I will go down and check each area that way. And then if I found any sort of issues with that, then we could go into some like a light touch. So I have like a brush to see if they can tell where the light touch is. And so I'm going to kind of brush in a random pattern, comparing this leg to the other leg. And then I'm also going to do 2-point discrimination. I don't have the tool, but a lot of people take a paper clip and they adjust the distance between the two ends, and they have them close their eyes and try to see if they can discriminate between one end and the other. And they say, can you feel 2 points here? Maybe only put one down. Can you feel 2 points? Just to see, just to test. And then maybe change the distance, bring it close together like that, and kind of go down in that same pattern and compare left to right, and just kind of keep going like that and see if you see any asymmetries with that. And then so now we can test temperature. I have this with warm water in it, and it's a vial of warm water. And then I can just kind of use the cold steel as part of this hammer, and I can say, is this, of course they're blinded, they have their eyes closed, is this warm or cold? And then I would take the cold steel, is this warm or cold? Kind of go down in that same pattern, again looking for asymmetries in how they sense between the residual limb and the intact limb that would be right here. And then the last couple things that I would want to test, of course I can blind them a little bit more, maybe with like a shield or something like this. And I say, so for proprioception, am I flexing the hip like this? Or I wouldn't lead with that question. I would be like, what position is your hip in? And if they could say flex forward or moved up a little bit, then that would be correct. And of course, maybe I could bring it out, like adduct it without telling them, and see if they can sense what positions it's in. And then for kinesthetic testing, I would say, what motion am I doing? Am I flexing the hip? And of course, I would be careful not to lead any question. I'm saying, how am I moving your hip? Am I moving it out to the side? That kind of thing. And compare that with her other leg, and see if there's any asymmetrical differences between her sensation. All right. So now to continue with this case, we're going to instruct the patient and show them how to do ACE wrapping for above the knee amputation, which is really important for shaping the limb so that the patient can get ready for prosthetic use. So what we're going to do is we're going to take one of the longer ACE wraps here. We're going to start, I'm going to kind of go, see if I get this right, this way. Start here and try to come down and around the bottom of the limb here. See if I can hold this, go around the back here. See if I can get this right. And then come up and around. And then so there's a lot of wrinkles in it right now. I'm just trying to get it on tight. So you kind of come back, make sure that you're getting all the wrinkles out before you move on here. There we go. Pretty good. There we go. And then check the back, see how it's wrapped on the back there. Okay. And then so now, so this is the hip. This is the residual limb here. I'm going to kind of come up to the hip and then come around the back. And this is the anchor, kind of going around the hip. Alright. Again, as you go, maybe just when you get a chance, a comfortable spot, you always want to check the wrinkles, see how you're doing with that. My setup here is coming apart a little bit. Okay. Alright, there are some wrinkles here at the hip, just because of the way my setup is with blankets and a coat hanger put together. So now we're coming across the front of the hip. We're going to come across the front and then go around the back of the hip. Try to come down and around one more time. And so you're kind of coming down to the medial inferior part of the stump. There we go. Right here. And again, the purpose is to try to overlap in a slightly offset spot than the previous time. So I'm going to kind of come maybe more anterior this time. And see if I can end the strap in a spot where the patient can reach. I have the Velcro style of ace wraps, but to secure it well, you would want to tape it down. Let me see if I can get this stuck down here in a good spot. There we go, right there on the front of the hip. Okay, that's bandage one. Make sure I check the wrinkles real quick. Okay, and so I got another one. We're going to kind of do that same thing again, trying to make sure we get really good medial coverage here. Alright, okay, so I had to cut there just for a second to make sure the hip part of my blanket mannequin makeshift situation was staying together. And so I'm kind of tacking it down a little bit more laterally this time for the second wide. This is the second wide wrap. Kind of tack it down a little bit better. And then as I'm coming down laterally, I'm going to kind of go along the back here. And let's see if I can just scoot it up just a little bit more. Alright, there we go. So now I'm kind of coming across the back of the hip here. See if I can make sure I keep all these wrinkles out of it. Make sure you can see still. There we go. Okay. Now I'm coming around the back of the hip, just like I did with the last one. And normally you want to make sure you're kind of visualizing along the back just as much as you are along the front. It's just my mannequin. It's probably not going to stay together that well. I'm trying to reposition the hip, the coat hanger hip, so that it stays kind of more laterally. There we go. Okay. Alright, and then so now I'm coming around the outside, wrapping here. Now that I got that there, I'm checking all the wrinkles. There we go. Okay. And so I'm coming across the front of the hip, and then as I kind of wrap around the front and come back around, you're going to want to try to come all the way down to the stump now. just like this. Wrap around the front. Kind of do one more figure 8 and then end right along here. See if I can get my Velcro out so I can end right in the right spot here. Probably have to pause once I get this tacked down so I can get my coat hanger hip more laterally. With the pressure, it's kind of scooted more into the middle, so it looks less like a hip and more like just a continuous roll here. There we go. All right, I'm going to tack that one down right there where the patient can reach it. And of course, again, you're going to look at all of your wrinkles here and just make sure you keep them as synchronous as you can. Make sure everything's flat. All right, I'm going to pause here for a second. All right, and then so the last strap here is going to be the smaller one. So we can just kind of go in a circle here. So you can kind of go here, maybe tack it down right here. Kind of like you're going this way. Trying to make sure I get some medial coverage here. Kind of come around the back. Again, you're checking all these wrinkles here. And again, a good amount of overlap. Obviously, you don't want to put one bandage right on top of the other, but you do want to make sure that there's a little bit of overlap. And maybe this one is the most inferior I'll go. With the long strap, the long A-strap, I should have gotten a decent amount of stump pressure here. So this one I'm kind of ending up high here if I can. There we go. Let me get the Velcro out. There we go. I'm going to kind of try to put it in a spot where the patient can reach it. Right there. There we go. And let me check all around for wrinkles. And like I said before, I would normally be doing that the whole time. Just with this particular setup, I had to cut a couple times because the bandage was falling between the hip joint there. There we go. Okay. Alright, so a couple things that I want to make sure I cover before I end the video is we are going to be wanting to monitor the shape of the limb. We definitely want to have sort of a distal to proximal like pressure gradient, so that way it shapes kind of like a cone shape. And that's going to be the best for preparing the patient for a prosthetic fitting. So like as we're working on the ACE wrapping, we always want to try to get like a distal to proximal pressure gradient, just like that. And of course, documenting the current shape of it, like on the first visit, is important. We're going to check the skin condition. So we're just kind of looking for, like the incision site, or the amputation site, I should say. Trying to see if there's any signs of infection, if all of the color looks good. Sort of like that kind of goes along with circulation, making sure that there's no area that looks infected or anything like that. And then one thing we can do for circulation is try to just take a femoral pulse here, kind of on the inside medial thigh, and just kind of compare that pulse to the other side, and then just kind of document what their heart rate is via that pulse. And then also the last thing we want to make sure we document is the circumferential measurements of the sump. So I'm going to start as proximal as I can. I'm using centimeters. So I'm just kind of go up and around like there. All right. So I'm getting 56 centimeters. I'm just going to hold it there. And bring this down. And then I'm going to go with 5 centimeters. But as long as you document how you're measuring circumferential measurements, that's the most important thing. So I'm going down 5 centimeters, and I'm holding right here. And now I'm going to do another circumferential measurement. Up and around. Okay, and then so that's a little more than 56, maybe 56 and a half centimeters. Again, hold it right here. And then go again 5 centimeters down, so now I'm here. Right there, okay. One more. Okay, that one is 54 and a half centimeters. Right again, I'm going to undo it here, and then go 5 centimeters down. And this is probably the last one that I'll do, just because I'm going to run out of stump. Right there. This is the most distal measurement. And so this is 52 centimeters. And so you would just document all of those measurements and say that it's every 5 centimeters that you're measuring it. Okay, something I wanted to make sure I mention at the end here after watching the whole video through and putting it together. I think I went medial to lateral with the last strap, whereas I should have gone lateral to medial. So that way I could kind of organize it so that whenever each time I put the ace bandage down on the lateral aspect, I could make sure that I was overlapping at the correct amount. You know, on each ace bandage, I wanted to make sure I was correctly spacing it out. So I think that's the only thing that I did backwards. Everything else, I think I did really well, covering the medial aspect with the wide ace bandages. I just want to make sure I mentioned that. Thank you.